Alright, today we're going to be doing the posterior drawer test. We're testing the posterior talofibular ligament. What we're going to do is stabilize the distal tibia and fibula, have our patient long sitting or supine. What you're going to do is place the web of your hand into the talus, and we're going to drive a posterior distraction force. We're looking for laxity and pain in the PTF ligament. There's no alternate names for the test. Make sure our patient is relaxed during the test, and we're testing both sides because you want to test the unaffected side first. There are no compensations for this test. The only compensation for this test would be if the patient's not completely relaxed or there's too much swelling. That won't allow for us to feel the full range. Next, we're going to be doing the percussion test. They're also known as the tap test or the bump test. What we're testing is the bony structures, the bones of the foot or lower leg. What you're going to do is stabilize the most distal region or proximal region of the bone you're testing, as long as it's away from where you're testing. You're going to do the unaffected side first to kind of let them know what they're going to feel like. So we're just doing a quick tap to feel for percussion. You can also use a tuning fork. You can also apply an axial load, and we're looking for pain in that region of the suspected fracture. Next, we're going to do the affected side. Again, we're looking for pain. There are no compensations for this test, and that's the percussion test. Next, we're going to be doing Morton's test. With Morton's test, there's no stabilizing. What we're looking is for Morton's neuroma, which is nerve damage to the nerves in between the metatarsals. We also could do a secondary test of metatarsal fracture because of the squeezing of the foot. What you do is grab the midfoot right above the metatarsals, and we're applying a squeezing pressure. We're looking for any pain associated with that. Then we're going to do the affected side. Again, we're looking for any pain associated with the squeeze. You're going to have your patient in a long sitting or supine again, and there are no compensations for this test.